It shouldn't. The JCVI reaches conclusions based on a number of criteria which aren't directly relevant to public health and to the health of the population as a whole. It's the chief medical officers who have considered that and have decided to recommend that young people should be vaccinated because it's safe for them and it's good for them and for the community as a whole. So there should be no confusion whatsoever. Vaccinating of children is good.
What would you say to people concerned that the JCVI had said that the margin of benefit is too small to recommend universal vaccination for this age group and that greater certainty from data may not be available for several months?
Well, I reject that. I reject that totally on various grounds, but even they accept that there is at least marginal benefit. And when we're talking about a disease that is potentially so serious, in children, less so immediately, but we do know about long COVID effect in children, and there's more research going out into that. But certainly, by way of reducing transmission in the population, young children possibly transmitting it to the older generation, who even if vaccinated and they were to catch it, and there's 5% who might, would be so severely affected. So the benefit, even the slightest bit of benefit to a child is worth it, and the benefit to the population as a whole is tremendous, and therefore it's absolutely clear that for the community it is the right thing. There's no doubt about it whatsoever. And in fact, I've been predicting that this would be the case, that it would be approved in the UK, and so we're ready to roll it out in Gibraltar.
Does consent for the vaccine lie with the parents or the children in this case?
In medical circles, it's usually the age of 16 in which that would be the case, but even in that case we did seek parental consent, and in this case it's parental consent will be sought. If I can imagine that the younger children might more or less be willing to go along with it. Maybe a 15-year-old may have a discussion, but that's for the family to decide between them. We are asking for consent from the parents. We are asking for informed consent from the parents. There will be material being given to the parents explaining all the aspects and explaining why this is to be recommended.
And that material will take in, I assume, conditions such as children with allergies, for example, and what the specific advice is there.
It will provide all the relevant advice. If any particular child with any particular condition is concerned, then clearly they can seek direct medical advice. And particularly in children who may be vulnerable for other reasons, then even more should they receive vaccination. Remember that COVID is a deadly disease, it's out there, and any little thing we can do to reduce risk for children, for adults, for the elderly, and for the whole population is a risk we cannot afford to take. So the vaccination of young people gives us an opportunity to decrease risk further and to come out at the end of this dreadful pandemic.
Will the isolation criteria for vaccinated children be adjusted? For example, will they perhaps not have to isolate if they come into close contact with another child who has COVID, as we've seen has had to happen in the past?
This is likely the advice that we will be getting from the Director of Public Health. The advice on isolation is under constant review, and I believe that the latest advice that we are about to receive from previous discussion is that vaccinated children would not be required to have as much isolation as they would otherwise have had for good reason. They are vaccinated. There is that incredible layer of protection that we are adding. We've heard statistics from the United States. Remember that vaccination for children has gone on in the United States, I think since May. The European Medical Agency also has cleared it, and children in Spain, for example, are being vaccinated and in fact more protected than our own children. We cannot let this opportunity go. We have the opportunity to vaccinate our children, and we've got to take the opportunity.
With regards to adults, the government said on Monday that the GHA was awaiting the JCVI's advice on boosters. It's now recommended boosters for the over 50s, the at-risk and frontline healthcare workers. Will Gibraltar follow suit?
Yes, absolutely. It's important that we should do this. We have been waiting for the UK's position. Clearly, we receive vaccines from the UK, and we are incredibly grateful to the British government for doing this. So we tend to follow whatever action they take there, and there are plans already in place to provide these boosters.
Presently in Gibraltar, people are considered fully vaccinated if they've had 2 doses of the vaccine. Will this expire at some point? Will people not be considered fully vaccinated until they've had their boosters as well?
The advice isn't there yet. We are still within the period where the vaccine is seen to be effective, and therefore the 2 doses is the criterion that we use. If, as time goes on, there's a change in the research and change in the advice, then we will adjust accordingly. But I think it's too early to say. I think the booster is a good thing. I think it will increase the immunity of the individual and obviously of the population. But whether the criteria will change is too early to say. But we will be ready to respond when we get the advice that we need.
How many doses of vaccine will Gibraltar need for the 12 to 15-year-olds and for the boosters for adults? And is the government confident of obtaining these?
Well, so far we've obtained enough doses for double dosing 40,000. So we are confident, with the support of Her Majesty's government, that this will be available. From the school population, we're talking essentially of comprehensive school age, and that's about maybe 2,500. And we can do that very quickly. We have all the processes being prepared. I don't have the information on the over 50s, but I'm sure that is easily available.
Is there a time frame for the vaccination programme for 12 to 15-year-olds to begin?
As soon as we have the vaccines in place. There are some vaccines in Gibraltar. I need to confirm when we will have sufficient, but the consent letters are going out very, very soon. We have the protocols in place, so we'll be ready as soon as the vaccines are available.
And a time frame for the over 50s, or is it too soon to ask for that?
I think it's too soon. I think it's recommended in UK that this will start around October time. October is just a few weeks away. But as everything else that the GHA leads on vaccination, and my colleague, Minister for Health, Samantha Sacramento, is leading on that. But I'm absolutely sure that, as she's been all along, she'll be more than ready with the GHA to take that on as well.